Last year, there was an alarming nearly 45-fold increase in measles cases in Europe, according to the World Health Organization, WHO. Health experts are concerned as cases are still on the rise, and they're urging for urgent measures to prevent further spread. In 2023, a total of 42,200 people were infected, compared to only 941 cases in the whole of 2022. The WHO believes this increase is due to fewer children getting vaccinated against measles during the COVID pandemic. In the UK, health officials are warning about a highly contagious measles outbreak in the West Midlands, which could spread rapidly to other towns and cities with low vaccination rates. More than 3.4 million children under the age of 16 are currently unprotected and at risk, according to NHS England. Parents and caregivers are being contacted to make appointments and ensure their children are fully vaccinated against measles. The measles, mumps, and rubella, MMR, vaccine is given in 2 doses, the first around the age of 1 and the second when a child is about 3 years and 4 months old. Dr. Hans Kluge, the regional director at the WHO, expressed concern about the situation in Europe, mentioning a 30-fold increase in measles cases, nearly 21,000 hospitalizations, and 5 measles-related deaths. He emphasized, vaccination is the only way to protect children from this potentially dangerous disease. Measles can be serious at any age, starting with a high fever and rash, but complications can include pneumonia, meningitis, blindness, and seizures. Babies, pregnant women, and those with weakened immune systems are most at risk. The WHO is urging all countries in the European region to detect and respond to measles outbreaks quickly while increasing vaccine coverage. Measles affected all age groups last year, with 2 in 5 cases in children aged 1 to 4 and 1 in 5 cases in adults aged 20 and above. Between January and October 2023, 20,918 people across Europe were admitted to hospitals with measles, and 5 measles-related deaths were reported in 2 countries. Vaccination rates for the first dose of the MMR vaccine slipped from 96% in 2019 to 93% in 2022 across Europe, and the uptake of the second dose fell from 92% to 91% over the same period. This slight drop in vaccination rates meant that more than 1.8 million children in Europe missed a measles vaccination during those 2 years. The WHO reports that the COVID-19 pandemic significantly impacted the immunization system, resulting in an accumulation of unvaccinated and undervaccinated children. With international travel booming and social distancing measures removed, the risk of measles spreading across borders and within communities is much greater, especially in undervaccinated populations. The WHO is warning that even countries that have achieved measles elimination status are at risk of large outbreaks. They emphasize that 95% of children need to be vaccinated with 2 doses against measles in all communities to prevent the spread of this highly contagious disease. Stay safe, and let's work together to protect our communities.